Hi everybody, we are going to continue with the second lecture of the cardiovascular system, focusing on the heart anatomy. So last time we finished up with discussing the four chambers of the heart, and the four chambers of the heart was broken down to two superior chambers, which we use the general terminology, if we're talking about both of them, as atria. This is basically the plural version of an individual atria, which is basically atrium. These two chambers were sitting on the superior aspect of the heart, and again, their job is to receive blood from blood vessels that are basically categorized as veins. Now, just kind of a review from the previous lecture as well. We discussed that the right side of the heart always carries the blood that is considered to be deoxygenated, versus the left side of the heart will carry blood that is oxygenated. Again, when we're color coding this up, it's kind of difficult for me to change the pen. But basically, when we're talking about deoxygenated blood, we always talk about blue color. And when we talk about the left side, blood that is oxygenated, it's always represented in red. So the right atrium is going to be receiving blood that has been deoxygenated, hence the color. And because it's deoxygenated, it means that it's coming from the body which has used up the oxygen. So it's basically coming from the systemic circulation. Versus the blood that is coming into the left atrium, this blood has gone to the lungs and it's oxygenated blood, hence the color red again. And therefore it is coming from the pulmonary circulation because it's coming from the lungs. Now, the two bottom chambers of the heart are referred to as the ventricles. Ventricles are basically going to be the pump portion of the heart, the part that basically allows the heart to contract and move blood out of the heart. So again, same as before, right ventricle will be identified as the chamber that is going to be pushing blood, deoxygenated blood, to your lungs to allow for the gas exchange to take place. But the left ventricle is oxygenated blood, and therefore the oxygenated blood has to go to your body, and therefore it goes through your systemic circulation. Kind of connecting a point we discussed for blood vessels, the main blood vessels that are coming off of the left ventricle would be aorta, which is the largest blood vessel that you have in your body. Here's a picture just basically depicting what I've already talked to you guys about. Here we have the four chambers. One, this is the second one. These are on the right hand side, so right atrium and right ventricle. Here on the opposite side, we have the left atrium on top and left ventricle. Something to get familiarized with right now is the movement or direction of blood vessels that are entering the chambers or leaving the chambers. So right here you have this blood vessel and this blood vessel is coming into the right atrium. Again, recalling the blood that is coming into the right atrium, which is this blood vessel right here, the one from the bottom and the one from the top. These two are coming from the systemic circulation. So if I was to identify these blood vessels, this would be superior vena cava, and this one would be inferior vena cava. These are the ones you should already know. If we're talking about the left ventricle, this is the blood that is going to this is this large blood vessels that are circulating. It's going into the systemic circulation. So this blood vessel we see actually as the aortic arch, which we also talked about before. This one would be aorta. Sorry, it's aorta. Now, the other point that I need to make is the separation you see between right and left is a very clear separation, more specifically in ventricles. It still exists in the atria, but it's a much thinner one. So we have one right up here, which is called intra-atrial. Intra as means as between. Interatrial septum, which means between atria. And interventricular implies separation between the ventricle. Basically what it is, it's a myocardium or your heart muscle that separates the right from the left-hand side. So reviewing what we already know about arteries and veins, so since we already talked about blood vessels, let's go ahead and take a look at this question about, information about blood vessels. So we have two major categories of blood vessels. We describe one as arteries and describe one as veins. Let me just change my color of the pen. I don't know what, let's see. Oh, okay. So arteries are any blood vessels that are going to be leaving the heart. Again, it doesn't describe what type of blood is in that blood vessels. It could be oxygenated or deoxygenated, especially when it's associated with the heart. But the key point is that it's going to be leaving the heart. Now, when we're discussing arteries, these blood vessels are originating from the heart, and again, it's leaving from the heart, move the blood to more distal places. Vein, on the other hand, are the blood vessels that are actually returning blood to the heart, or basically move blood back to the heart. Again, that does not imply that you will have oxygenated or deoxygenated blood specifically in them. It's just the direction of the the blood movement. So let's take a look at the blood vessels that are, let's take a look at the chambers of the heart in a little bit more detail. These are information you need to know about each of them in a sense of their anatomy. So I'm using color pencils today, so let's see what happens. So first, let's start with the two atria. So the atria we identified as, again, repeat it so you guys remember it, receiving chambers of the heart. Now, if you go back and look at the pictures, what you notice is that the muscles or the myocardium around this are relatively small, so you don't really need to have much of a push or contraction associated with these chambers. So they are, as the second point made up, the second point is that it contributes little to proportion of blood. Again, so because you don't create as much contractile force, then it doesn't really help move the blood. Now, on top of the two atria, we have these structures or flaps that are referred to as auricles, like ears. These are extra appendages that help atria increase its volume when it's needed. So depending on the activities that you're doing, sometimes your heart needs to bring in more blood so it can increase the blood flow to your tissue. And it does that by filling up the two auricles on both left and right side. Now, let's go ahead and take a look at, actually, let me show you, going back to, I'll show you on another picture because I thought I had a full picture, but I don't. So let's start talking about the right atrium. So right atrium, again, it's the top chambers on the right-hand side. The type of blood you can find in it is deoxygenated blood. The top portion of the wall of this chamber is very smooth. However, as you start to go down more toward the ventricles, there start to form ridges on the surface, and these ridges are called the pectinate muscle. Now, we have three main veins that are associated with the atrium, which basically means bringing blood back to the right atrium because right atrium is receiving blood. So a couple of them should be very familiar to you. Superior vena cava and inferior vena cava. Superior returns blood from the body regions that are basically above the heart, which basically implies your neck, your head, and your arms, or your upper arms. It also includes your thoracic cavity, part of it. Inferior vena cava basically returns blood down from anything below your diaphragm, which includes your abdominal cavity and your two lower limbs. The last one, which should be new to you, is the blood vessel called coronary sinus. Coronary implies heart. So coronary sinus implies the blood vessel that collects blood from the heart itself, the oxygenated blood from the heart itself, and return it back to the heart to be oxygenated. Do remember that your heart is a pump. It does contain cells and tissues, and those cells and tissues are still going to require a significant amount of energy to be able to do their job. And for the production of energy, you need oxygen. So here's a picture that basically our focus is on. Right here, you have the superior region of the right atrium I was talking about. It's relatively smooth. The bottom part of it, you see these ridges that's called the pectinate muscles. You have the superior and inferior vena cava that are emptying here. This is for the entrance to the right atrium from the inferior vena cava. And this one is the entrance for the superior vena cava. They don't represent the coronary vein because it's relatively small, but it also does come in more on the superior aspect of the heart. Now, on the other hand, we have your left atrium right here. So left atrium receives oxygenated blood, and this is the new blood vessels that are going to be discussed, from 4 pulmonary veins. Let's break down this concept for you. Left means that it's going to receive oxygenated blood, right? Left atrium is oxygenated blood. Because this is an atrium, it means it's receiving blood, right? Atrium implies receiving of the blood. And because it's left, that blood's going to be oxygenated. So it means it's coming from pulmonary circulation, and because it's coming back to the heart, we use the word vein. Now there's total of 4 veins. These 2 right here, which is coming from the right lung, called right pulmonary vein. And you have 2 coming from your left side, called left lung, called left pulmonary vein. Don't assume just because these blood vessels are shown here, they're emptying into the right atrium. They actually go behind the heart and empty into space right here and right here. Now, the bottom 2 chambers of the heart are referred to as the ventricles. So let's take a look at ventricles and see what we need to know for those. So ventricles are identified as the discharging chambers of the heart because they need to discharge blood out of the heart. And again, look at the word here. These are the actual pump of the heart. They require a thicker walls than atria. When we're discussing the concept of walls, what we're focusing is myocardium, which is basically what? Heart muscle. So we're talking about heart muscle, and because heart muscle creates a contractile force, I need more of them in the ventricle so I can literally pump blood out of the heart. It is make up most of the volume of the heart because again, you need to push blood out of the heart actively. We do know that we have right ventricle and left ventricle. Right ventricle is, if you look at the positioning of the heart, is more toward the anterior surface because your heart is actually kind of twisted to its lateral aspect. And left ventricle, position-wise, there are more toward the posterior / inferior aspect of the surface of the, or within the thoracic cavity. Now, inside the heart, we have muscles that are very similar to pectinate muscle we discussed for the right atrium, but in this case they're called Trabeculae Cornea, which basically irregular ridges of the muscle in the ventricular wall. Very similar, not similar, I should say, analogous to the ridges of the muscle we see in the right atria called pectinate muscle. We also have these kind of finger-like extensions called papillary muscles, which are projections coming off of the ventricle, both left and right ventricle. And they're connecting to these string-like extension called chordae tendineae. Chordae tendineae. Basically, these are extremely important for the functionality of the valves of the heart we'll discuss in a few minutes. So, let's again take a look. So I have the first point that we made is that the ventricles, which is right here and right here, are larger compared to the atria. We have these patterns of muscles you see here and the background right here. These are referred to as the Trabeculae Cornea. These finger-like projections you see here, and again additional ones here, they are referred to as the papillary muscle. And what they are holding is these strings you see right here, right here, right here, and right here. And these are the strings that are called chordae tendineae. And their job is to hold these structures you see in white, which are basically the valves we will discuss in a few minutes. Now, what are the blood vessels that are associated with the left and right ventricle? So let's review that. So the left ventricle should sound very familiar. This is the one that has the oxygenated blood. You see this sign right here? So it goes through this tiny opening, it goes up, arches, and then comes down. So that forms your aorta for the left ventricle. On the right hand side, or the right ventricle, this blood is deoxygenated. So the goal is to send this blood to your lungs. Now you have two lungs, but there's only one blood vessel that is exiting. This is again relatively large blood vessel. It is going to your lungs, so we're still gonna use the word pulmonary, but because of the size of this blood vessel, we use the word trunk to describe it. So pulmonary trunks comes out and branches to one, and then it goes behind. So I'm gonna do it as dashed line. It goes behind and it becomes this blood vessels. This one is going to the right lung, so we refer to it as right pulmonary artery because it's taking blood out of the heart or away from the heart. And this one's going to the left lung, so it would be referred to as the left pulmonary artery. The key point that you guys do need to remember. Pulmonary, let me change my color so we're sticking to the color coding that we described. So this blood vessel right here, we identified as pulmonary trunk, and then it branches to the pulmonary arteries, right? So among the blood vessels of the heart, pulmonary trunk and arteries are carrying what type of blood? Deoxygenated, even though they are what? They're considered to be arteries. On the other hand, what I have, sorry, the pen doesn't let me change the color. On the other hand, what I have on here, oops, I should really select this. Here I have blood coming back to the heart using my 4 pulmonary veins. Pulmonary veins. Oh, Wow, what happened? Sorry, guys. Pulmonary veins is going to be carrying, let me just do this again, sorry guys. So you have this, 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 and this. These are identified as pulmonary veins. And again, remember, veins is blood that's coming back to the heart, but this blood is oxygenated. So always remember, the blood that flows in the blood vessels does not determine the color of the blood, quote unquote, does not determine are they arteries or veins. It's mostly focusing on the direction the blood actually moves. Toward the heart is always veins. Moving away from the heart, it's always arteries. Okay. I'm going to stop the PowerPoint here and we'll continue with the next one